Here at Royal Cornwall Hospitals, we have a dedicated charitable research fund that is utilised to support research trials and research studies and anything really that supports the benefit of patients undergoing research projects to improve their treatments. We've also used our charitable funds in order to put together the suite that is been designed specifically for patients undergoing oncological treatment, and it's to create a nicer environment really for those patients.
I'm going to talk today a little bit about my research project, which was the Godrivi project, which I undertook mainly when I was one of the clinical fellow doctors in clinical oncology. The project was first devised with this idea of having a virtual reality-based distraction therapy for use within oncology and palliative care that also was almost personalisable, so we could take our camera out and film different locations if a patient had an event or a particular view they wanted to see as they're approaching the end of their life. We went out around Cornwall and filmed lots of different locations, including Godrivi Lighthouse, which is the inspiration for the name of the project. I applied for funding through the RCHT's Dragon's Den, and so that's where the majority of the funding came from. Then for publication and consumable costs, the RCHT research charity supported that. And then just the work in the background and behind the scenes, all the support with setting up the administration side of thing, applying for research ethics, getting a sponsor for our trial, all of that wouldn't have happened without the research team here. So it really was invaluable having their support and their expertise to move forward.
Research allows you to experiment with cutting-edge treatments, allows you to challenge yourself. And research in itself is defined as the creation of new knowledge or using the existing knowledge in a new and creative way.
There are loads of benefits to my career in this role. I get time to perform audit and other kind of useful researchy bits for my CV. I'm gaining lots of skills in how to be a sub-investigator in trials, and I'm also getting some training in what it's like to be a PI. So I've recently completed an associate PI course with NIHR as well, which I never would have had the opportunity to do working on the wards, so that's been really, really good. And I'm also getting lots of time to pursue interests in teaching and getting lots of practice working with medical students and other junior doctors. And I also get lots of teaching myself, so I'm learning lots. A big thank you to the R&D department for supporting this role. I think it's really important to support young doctors in developing their career in research, because it's not something that we get lots of exposure to in our training or in our kind of early careers. So it's a really, really good thing for the R&D department to be providing this opportunity for doctors early on in their careers.
Research doctors helps recruit patients. It helps confirm eligibility for patients that could be eligible for a study. It also allows patients to have continuity of care, medical care, whenever they need it. They can be assessed promptly and they can be referred to any service if necessary.
one of the research team, a young lady, came to see me and she said, would you like to join a research program? And you'd be taking a trial drug and you'd be helping other people. And I thought, well, why not? If I can help somebody else, if I can help myself, then great. They put me on a trial. And that then, I think it was every 3 months after that, I went back for another visit, blood pressure, blood test, and a chat. And it was dead easy, but it was also, for me, very comforting. Because all this heart thing was new to me, I had no idea. You get a little twinge and you think, oh, what's that? And I knew I could phone them up and I could speak to somebody, and if the person on the phone didn't know, they would get someone to ring me back. And it was great because they were there. And you know, I would recommend it to anybody, in all honesty, that was in the same position, because you've got nothing to lose. The research team, I thought, were fantastic, and I think that was the best thing about it, from my point of view, was that support. And I was disappointed when it ended. I was pleased in the end because obviously it was successful. The actual program was successful when the drug was licensed.